On this program, we speak a lot about the opioid crisis. Well, now new information has just been made public finally that shows the scope of the problem. The Washington Post and other papers, they've won a major legal battle to have the government finally release data showing how many pills have been distributed. The findings, well, they're nothing short of shocking. 76 billion, that's with a B, 76 billion pills were distributed just between 2006 and 2012. That resulted in nearly 100,000 opioid-related deaths during that window. Now, the data, it also shows that rural areas, they were hit especially harder, even harder than cities, and less affluent states were hit particularly hardest. The number of pills in West Virginia equaled 66 pills per person, man, woman, and child, every year. Kentucky not far behind with 63 per year per person. South Carolina, Tennessee, and Nevada rounding out the unfortunate top 5. Ohio, it is also dealing with a major opioid problem. 60 Minutes, they did an explosive segment on the epidemic. And here's Governor Mike DeWine explaining the scale and the scope in his state. DeWine, I should note, was the Attorney General before becoming governor. Take a listen.
They flooded the state of Ohio with these opioid pills that they knew would kill people.
They knew would kill people.
If they didn't know it the first couple of years, they clearly would have seen it after that. You can't miss it. When one year we had close to a billion pain meds prescribed in the state of Ohio, 69 per man, woman, and child in the state, and that lies at the feet of the drug companies.
Attorney Paul Farrell, he joins me now. He's one of the lead attorneys representing hundreds of cities and counties that are suing the pharmaceutical industry. Paul, thank you for the time. We've been dealing, like I'm sure countless other stations have, in our region with the epidemic, and we've heard from all perspectives, from those, thankfully, on the road to recovery, those who've lost loved ones, those in the throes of addiction, police, medical, treatment facilities, even religious organizations trying to deal with the scope. And to a person, they were all shocked by how fast this is all spread. The one thing I get from these findings, with this finally putting out there, is the people who shouldn't have been shocked were the pharmaceutical companies, the distributors, and to me, shockingly, our own government, the DOJ and the DEA. They knew. Is it fair to say they knew just how bad this problem was and was worsening?
Well, I think you have to define who they is, because there's different stories at different levels in the chain of distribution. But there's no question that every transaction of a pill of opium, from the manufacturer to the distributor to the pharmacy across America, has been recorded in a database maintained by the DEA. And through this litigation, the lawyers have been able to get access to the data at least back to 2006. So the data has been out there. The question has always remained is what they did with the data.
Let's be clear, though. Big Pharma has always argued, hey, we're just following guidelines here. There was a demand for the product. We were trying to address the needs of the patients, whether it was the patient's abuse of it or whether it was the distributors that were acting irresponsibly. You can't look to us. There's no way to look at this data, Paul, without saying that Big Pharma, and we're only talking about really a handful of companies that really controlled the vast majority of this, they had to know where their product was going and in the volume that could only be feeding addictions.
There's no question. I mean, if you look at the way they marketed these pills, where they market any prescriptions, they don't market just for fun. They know that targeted marketing works, and they're able to track where every pill goes. They're able to track which physicians prescribed it, which pharmacies dispensed it, which patients received it, and they're able to tailor their marketing programs to boost profits. But I want to go back and address something. This isn't laissez-faire economics. In 1970, Congress closed the chain of distribution so that only a few were allowed to engage in this business. I call it Willy Wonka's golden ticket. Not everybody was allowed to have a golden ticket, but if you got one, you got to make a lot of money. And one of the rules for having the privilege of making and distributing pills of opium is that you watched out for unusual patterns that could lead to diversion. And the volume of pills that we've seen isn't a sea level change, it's a tsunami.
Paul, explain to our audience what ARCOS is and explain why guys like you, states, district attorneys, attorney generals have been fighting to get this data to confirm what everybody was seeing on the streets. This database, this ARCOS, had been sitting there, and the powers that be were fighting forever to make the stuff against making it public. Finally, a court ruled they did, and now it confirms all the worst suspicions. Explain what was in this database and how long people have been sitting on this thing for before it finally saw the light of day.
So one of the best ways I think that I've been able to describe it is on Wall Street, how many transactions happen every day? What, thousands, millions, tens of millions of transactions? Well, the SEC isn't the clearinghouse for all those transactions. The SEC, if you go through and you get your trade processed, it doesn't mean you're in compliance with the law, and it's impossible for anybody in the federal government to actually serve as the clearinghouse for all of these transactions. But if something goes wrong, if some crime happens, the SEC does have the ability to go backwards in time and to identify exactly what happened through the data. The same thing here with the DEA. The DEA does not have the capacity, nor was it ever intended, to serve as a clearinghouse for all of these millions of transactions that happened. But the DEA could reactively go backwards in time and to look and identify exactly what happened with a particular customer or a particular transaction. What we've done as the lawyers in the case is we've gotten access to the entire national database, and we've been able to go backwards in time and recreate what actually happened all the way back to 2006.
Paul, let's try and get people's arms around. I gave some numbers at the beginning, but the sheer volume of, as you said, the tsunami of pills that have flooded communities. We gave ideas from the state levels, in West Virginia, as you know probably better than anybody, particularly hardest hit, but many other states in that category. But there were particular communities in those states where it goes from the mind-boggling to, I don't even know how to describe it. Mingo County in West Virginia, 203 pills per person. That counts from the elderly to the infant. Everyone in that county, that was the number of pills every year per person that were in that county. I mean, I can't even imagine the truckloads needed to just bring all the stuff in, but the idea that they didn't know or didn't intentionally target some of these places to feed this demand and addictions is inconceivable.
This is what I'm hoping for. So when you look at the number 78 billion, you're shocked, and you think, how could this happen all over the country? When you look at West Virginia alone, and you see 1.2 billion, you think to yourself, okay, that's a big number. But when you drill down and you look at your backyard, you look at your community. In my hometown, Huntington, West Virginia, we have 100,000 people in the county. We had 10 million pills every year for a decade. What my hope with this ARCOS data is not that the whole country looks at the 78 billion and says, wow, what a big number. I'm hoping the Topeka Tribune goes and pulls the data from Topeka, so that people can say, this is what happened in my backyard, not look what happened in their backyards, not what happened in Mingo County. I want the country to understand this happened in your backyard, and this is affecting your community, and I want this to be an awakening.
And the other thing, Paul, is you don't have to be Kreskin to figure out what happened as a consequence. First, it's the opioid crisis with the prescription pills. Then it turned into heroin that we saw play out. Now to fentanyl, and we can even attach the deaths that were attached to each stage of this thing that is continuing to mutate. Now, you have an analogy about a river where just the discovery of the problem isn't solving it. We're still in the throes of the crisis because we got to deal with it.
Yeah, so when you think about the small towns that get flooded, or even if the Mississippi, God created channels for the Mississippi. And every once in a while, the water comes out of those channels and will flood a community. Well, when the water goes back into the channel created by God, the crisis isn't over. It's just begun, because what's left behind is 3 feet of mud in your downtown, of your infrastructure, your electric, your sewer, your water. Well, the same thing happened here. Congress made channels for these pills of opium, pharmaceutical derivative grade pills of opium, to stay within a channel. And the pills came out in a tsunami, the greatest flood that has ever happened. So if we're able to get those pills back into the channel of true medical need, what's left behind are the devastated communities that we're going to have to figure out. And let me say this too. This isn't just the addicts. This is a multi-generational problem. The evolution of this epidemic has an impact to the newborns that were diagnosed with neonatal abstinence syndrome. And what we're seeing is that the newborns that are now being introduced into secondary school systems have both emotional and developmental delays. So this is a multi-generational issue that's going to affect us for the next 50 years.
All right, Paul. So what are you going to do to these guys? And I say you, a plural, the other folks who've brought these cases over the years, they've paid maybe even major settlements, but it's a cost of, frankly, doing business with the billions that they've made in profits. Now it's in black and white. What's going to happen to these guys?
They got to fix it, plain and simple. You broke it, now fix it. So you created this monster, you created this epidemic, now you're going to find the cure. And since they're not voluntarily going to do it, we're going to make them. So it's called abatement. If you come in and if Exxon spills millions of gallons of oil into the community, what's the penalty? Is the penalty a fine? Is it a ticket so they continue doing business? Maybe. But in addition to that, you have to abate the problem. And that you'll continue to pay penalties until the problem is abated. That's what we're asking for, is we're asking for those that caused or contributed to this epidemic to abate the epidemic on their dime, not taxpayers.
Well, I always say I wish you luck, but I wish you more than luck. I wish we have a little bit of justice here, and we also hope that folks making $1 off the most vulnerable in this country and being able to do it for so long will finally have to pay a far overdue price. Paul Farrell, thank you for the time. I appreciate it.
No problem. Thank you.
And up next, our 2020 Vision segment. New polls, new strategy for Joe Biden. That ahead of next week's important Democratic debates. But not everybody is a winner in these polls, including the man who's currently the occupant of the White House. Headlines, numbers, and analysis all straight ahead.